One of the biggest new measles outbreaks in the nation is right here in the mid-state, and that means consequences a lot of people never imagined. 60 years after the measles vaccine came out, Seth Kaplan begins our team coverage. Seth.
Alicia, I remember during the last Ebola epidemic being asked as a screening question if I had traveled to West Africa where that epidemic was centered. Never before been asked, have you traveled recently to Lancaster County? But indeed, that happened when I checked in for a recent appointment in Hershey. What happens if I say yes to that?
So we're definitely going to ask you a little bit more information because we want to make sure that if you have that epidemiological risk factor, that we're getting you that mask, that we're making sure that you're isolated away from other individuals.
Lindsay Burkheiser, Penn State Health's High Consequence Infectious Diseases Program Manager. Sean Mueller is the System Director for Infection Prevention.
And there have been big outbreaks across the United States. North Carolina, of course, has had a big outbreak that started at one of their colleges, along with Texas,
which gave the folks in Hershey a head start to learn from folks elsewhere.
They have the ability to say, hey, don't make the same mistake or run into the same challenges. We found X, Y, and Z were helpful, or that X, Y, and Z weren't helpful.
One thing very different about measles from the COVID-19 pandemic is the age range at greatest risk this time.
But when we're talking about babies and little toddlers, we can't always mask them effectively.
So they have to improvise.
Tenting them in their car seat with some kind of cover to help mitigate that risk of utilizing service elevators, for example, instead of a regular patient elevator to keep them on a road less traveled, so to speak.
We do have some backdoor ways to move people around, but we want to be very mindful of how we move patients throughout the hospital.
And there's a lot of things that we do behind the scenes to keep our patients safe.
The screening questions are a first step in figuring out who might be exposed.
So it's really a classic 3 I's.
So it's identify them.
Yep, isolate them. And then inform.
Inform internally, but also inform the state health department, which released these figures showing how concentrated the outbreak is in Lancaster and Lebanon counties. But for everything unique about each public health risk, they all have one thing in common.
Good respiratory etiquette and good hand hygiene are always a good idea.
And as for that extraordinary number of cases in Lebanon and Lancaster counties, we continue our team coverage with the newest member of the ABC 27 News team, Barbara Barr. Welcome, Barbara.
Thank you so much, Seth. Nice to be here. And you showed that map. Of course, all of Pennsylvania's 53 recent measles cases are in our area. All but 3 of those in Lancaster and Lebanon counties alone. Turns out that's not really because of anything new happening in Lancaster and Lebanon counties. Rather, it's because of some unhelpful developments elsewhere that suddenly matter here.
There are populations there of Amish or Amish adjacent groups that have traditionally had lower vaccination rates. But the thing was, why didn't we see outbreaks there before? It's because there was so much immunity in the population. Other people were vaccinated at much higher levels that sort of formed kind of a fortress around those unvaccinated enclaves. It's important to remember that not every case there has to do with Amish populations. There were some cases that were related to an outbreak in Florida.
And Dennis and Alicia, experts say the solution to this all happened 6 years ago, of course, when the vaccine came into effect. Everyone who's at least a year old, experts say, should get a measles vaccine.
Yeah. Hi, I'm Eric Finkenbinder from ABC 27. We're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home, and it's very easy to use. With a Fire Stick, go to the homepage, scroll down to search. From there, enter ABC 27. Move over to the apps, and there we are. Click the icon and install. It's just that easy.